the key messages we're trying to get out is that women have really taken a real let's suck it up buttercup sort of approach, and we're just as guilty as practitioners for doing that. Oh, it's because you've had 2 babies, it's because you're menopausal. And actually, we don't get to opt out of these things. We don't get to opt out of periods, we don't get to opt out of menopause, we don't get to opt out of childbirth. There is no other point where you go into a room and come out completely different physically and mentally, holding another human being. And that's quite a big transition. And we leave women, sometimes they leave that labour room and they don't actually address what actually happened in there, either physically or psychologically. And that's, again, one of the key things that we've picked up in terms of women's health is developing. And technology like ours is a small drop in the ocean compared to where we can actually go with this. We went into nursing to look after people, and sometimes when you actually talk to a patient about the symptoms of vaginal atrophy, for example, so the looseness, we can actually work out that it's not what they possibly think it is. It may not be the childbirth, it may be menopause, it may be problems with periods or dietary issue, anything along those lines. So we've got that knowledge to be able to really drill down with those patients as to what's going on with them. One of the examples we've had as a barrier to people getting information, and we've just found recently, we did a Google AdWords campaign and they blocked the word vagina.
They blocked it?
Yeah, so if women are looking for help, then one of the things they want to talk about is their vagina, so you're going to put that in the search engine. So one of the reasons recently we did a survey on about 1,800 of our patients, and it came back to us over and over again, education. We want to know, not just at secondary school about periods and having babies, but at later points of our life, about the menopause, when to be worried about periods. So we've developed quite a big change.org campaign to try and get, like you say, the primary caregivers to listen to what we're saying, because we are the voice of our patients, and our patients are saying they want help and they can't get it.
One thing I don't think I've asked yet is, how difficult is the treatment? How long does it take to recover? How long does it take to see the benefits? Are they in and out? Is this like a day service? Just a little bit about that.
So basically what happens is everything is done online before the clients come. So that's one of the other things that we've done, is we've built tech into it at every point. Some of the questions we ask, we need to have measurable data for research purposes. So questions about things like lubrication, sexual satisfaction, climax, can be quite difficult to ask somebody when you've never met them before.
Face to face.
Yes. So we have that, the patients do that form online, they're prepared with the nurse. They arrive on the day, we go through the form, pick up anything on the consultation, and we have 45 minutes. Some real cans of worms get opened up sometimes. Sometimes you can hear hilarious laughing, other times we can hear tears. The patient, it's their platform. At some point they decide they want a treatment. Again, all the forms are online. Take the patient through, and the treatment takes about 10 minutes, 10 to 15 minutes. Yeah. Very similar to a cervical smear test, and the cage is put in. I think we've got a video on our YouTube channel. We'll put the video, the laser head in, and we fire that. And what it does is it creates lots and lots of tiny micro injuries. It's not very uncomfortable for women because there's not many nerve endings in the vaginal area. Once we've finished on the inside, we then treat all around the outside of the entrance to the urine tube, the urethra, around the entrance of the vagina and around the labia, which stimulates new collagen growth and plumping and so on, and improves, for about 8 to 9% of our patients, sexual gratification goes through the roof. So it's a happy side effect. After the procedure, the patients feel on the outside a little bit like they've been out in the sun, a little bit warm. That lasts usually for about 24 hours, anything up to 72 hours, because the first phase of wound healing is inflammation. 4 days post-procedure, they can get back to normal with things like sexual intercourse, swimming, and so on and so forth. Most women find that within a day, everything's feeling like it's back to normal.
What about the complications question?
There's no real complication. The worst case scenario is a patient may get a touch of thrush, and that's usually because the pH balance is a little bit out of whack, sometimes as part of the menopausal journey, or because we've altered that tissue there. But the vagina is a self-cleaning organ. This is why the panty liner industry is so buoyant, because we're constantly producing that mucus where the cells are turning over. The main difficulty is the technology to assess exactly what happens to vaginal tissue doesn't exist. We've got MRI and CT scans, so when people are looking at clinical data, we can't actually look at the minute detail, so we actually have to go on what our patients tell us. So things like I found that going to the bathroom was easier, I found that intercourse was more pleasurable or less uncomfortable. So that's something that we're working quite closely with a lot of other healthcare practitioners, so urologists and gynecologists, start working out how we can start to really see what's going on with patients, and that's quite exciting.
Well, you raised the point that quite a lot of the feedback that you get is still considered anecdotal because the science actually hasn't
It doesn't exist
paid
yet.
attention.
Yeah.
So perhaps now primary care and the people looking into the reasons why you're getting such amazing feedback are now going, well, hang on, what is going on down here? Let's start inspecting from a science-led approach. So do you think that is also going to raise further awareness and provide you perhaps with some additional tools?
Most definitely. I mean, we've been going to quite a lot of the menopause conferences and so on, and everybody knows that laser works. They're not quite sure why. They know the nature of it. It's existed for a long while. So we're partnering with a consultant, a professor in urology, and he's like, I know it works, and I've seen it work, and I just don't know why. And I'm like, well, let's explore that. So that's what we're hoping to do.